Welcome everybody to our second segment of the series, our muscle activation practitioner spotlight. And today we have Charlie Cates from outside of Chicago, who's been a practitioner with us. He started the program in 2011, working through the Jumpstart program. And then he progressed through the internship and then right through master level. And in 2013, he got his master level certification. In 2014, we brought Charlie on as an instructor, and he's been teaching for us ever since. So we'd like to welcome Charlie Cates today for being here in our MAT Practitioner Spotlight. Welcome, Charlie.
Thanks so much, Greg. Thanks for having me.
It's good to have you here. Good to have you a part of the program. And just want to kind of talk through kind of your history with MAT. And maybe first off, if you can kind of give a little explanation of, what you were doing prior to MAT and starting when you went through the internship and what your career was, and maybe lead into how MAT impacted your career from that point forward.
You bet. So when before I started MAT, I was really into sports performance, and that really was my thing. And so my whole mindset was about, like physical performance. How can I help athletes in particular perform better? And I was doing it through the traditional means of strength training and, mobility work and stuff like that. And then when I started kind of transitioning into more traditional personal training, that is when I met a couple of MAT practitioners that introduced me to MAT. And the first time I got worked on, it was like all these light bulbs went off in my head. I was like, oh my gosh, this tool can help so many people from an athletic performance perspective perform better. Like, it's going to help their muscles work the way they're supposed to work. It's going to help their body work the way it's supposed to work. And now, then they're going to be able to train harder. They're going to be able to recover better. They're going to be able to perform better. They're going to be like more resilient to injuries. And it's like, oh my gosh, this is such an amazing thing. So I dove headfirst into the courses, because I feel like I'm one of the lucky ones where, I graduated from college, and then 2 months later, I was starting my personal training career. And then a month after that was the first time I got worked on with MAT. And then 3 months after that's when I started Jumpstart. Like the timing was just so succinct. And so fortunately, like being in Chicago at that time, there were a lot of classes coming here. So I had a ton of opportunity to really not have to travel much to go to different courses and whatnot. So I'm very grateful for that. But the whole initial idea for me starting MAT was, how can I use it to help athletes? How can I use it specifically because I was interested in youth athletes. How can I, help youth athletes with this? And the more I got into the MAT program, I definitely saw the place for it from a youth athlete standpoint, but I also began being exposed to how powerful it can be for all different types of populations. And, like you so often talk about, Greg, is like, athletes respond pretty darn well to pretty much anything. But this tool, you have such a unique opportunity to help people that haven't responded well to other things. And so I really started to get more drawn to that. And so my practice then has evolved from just strictly sports performance to really sports performance not being that big of a part of it at all, and really just focusing more on general population and helping people just feel and function better throughout their lives.
That's great. And the interesting thing, and as you know, in teaching courses, we go through kind of asking all the students what brought them there, and everyone seems to have a personal experience, and where they had their own injuries and they got treated by MAT, and you mentioned that you got treated, and that kind of opened the door for you going down this education pathway. But if I'm remembering right and understand, you had a history of chronic injuries going through.
Yeah. Right. So it's interesting because I played basketball through college, and by the time I finished playing basketball, like my body was wrecked. Now, I never had an injury that required surgery, but from the time I was in 5th grade through my senior season of college basketball, I was spraining an ankle at least once, if not more times during every season. So that first time that I got worked on, I was so disconnected from my body. I couldn't tell when things were weak or strong. I couldn't tell, like, I got off the down, like, okay, I think my hip is moving better, but I was just so disconnected because I was so used to just kind of guarding the areas that weren't working well. And then And then through being exposed to MAT and then getting myself worked on, more consistently, is like, oh my gosh, the changes I was experiencing in my own body, like more people have to experience this.
Yeah. And what would you say, I mean, conceptually, in the way that you were working and training with your clients, was there a main concept and the principles of MAT that just was, I mean, the red light, I mean, the green light turned on and said,
Yeah.
change
Yeah.
it.
So the big thing for me, before getting exposed to MAT, I was really big into stretching. I was really big into foam rolling. Like, I saw the value in making sure the joints moved well, but I was going about it, a completely different way, where I would spend, 45 minutes a day, no exaggeration, stretching myself, and, having this 15 to 20 minute, warm up that I do every single time, followed by, other 10 to 15 minutes of foam rolling. And what I found was, or what I experienced rather, is after all that, I was still stiff. I was still achy. Like, things still felt really tight.
Yeah. And that's one of the things, I mean, even for the listeners, is to understand, I mean, you see it, people stretch day after day after day, and they never get any more flexible. And literally, and that was kind of the whole foundational principle with my own history, having that fractured vertebrae is, I mean, I would stretch and get deep tissue massage and do all the things to try and loosen up the tissues. And then I couldn't get out of bed the next day because I'd have numbness and sciatica down into my big toe. And literally had a whole career based off of range of motion, improving range of motion through different stretching and deep tissue modalities. And I had a whole career that was based off of that. And literally MAT kind of, when I came up with the thought process, it was like a paradigm shift. It's that everything we were doing, spending all that time, like you said, you're spending all that time stretching, foam rolling, trying to get yourself ready to go play, but you weren't seeing any long-term changes. And that's pretty neat. Is I mean, the idea that mobility is a subset of stability and dependent on stability. And that, as you said, you started to experience what first muscles being contracting, then range of motion changing. I mean, it's a neat experience. And I'd say, I mean, in that you talked about working with athletes and then realizing this is something bigger. Like, it's not just for athletes to, as we talk, you can do anything wrong with athletes and still have success with athletes. But when you get to the normal public or people that are, I mean, systemically inflamed and stressed, all of a sudden it's like those people, the same principles aren't as solid. I mean, like, you can't do everything wrong with people that are systems are already stressed. And so, I mean, do you have an experience during your time working through MAT that you could say, man, this really blew me away with what the impact that I was able to have on one of my clients, and one or more experience that you could correlate there?
Yeah, for sure. So, I think so often with athletes and with exercise, we get so into the doing of the exercise, the doing of the training and everything like that. But like you're saying, Greg, like, if somebody's body's not ready for it, it can just break them down further. And so a few years back, I had a woman come in, and she had been trying to exercise on her own, but she just wasn't able to, because every time she did, she felt awful. And she actually told me, look, like, it's at the point now where not only do I not feel well, but like, I'm borderline type 2 diabetic. Like, I just got my blood panels back. Like, things are not looking good for me. And so by starting with MAT with her and, building up the tolerance of her system to be able to be more physically active, after about 6 months or so, she continuously progressed. And then she got her blood work redone. She's like, yeah, because of MAT, I've been able to exercise on my own more frequently now. Now I'm no longer at risk of developing type 2 diabetes. Like, completely changed, her body's ability to not only just tolerate exercise, but tolerate stress in general. And so then, because of that, it was like this freedom that she didn't have before. Now she had.
That's awesome. And that's probably one of the major things. I mean, this is a biomechanically based process, and basically off the foundational principles, wherever you see limitations in range of motion, it means that one or more of the muscles that cross that axis are weak. And with athletes, you treat those muscles, and all of a sudden it's like, wow, my ankle doesn't hurt as much anymore, and I can walk on it and put forces on it. But like you said, I mean, systemically, this woman being borderline diabetic, all of a sudden, I mean, her ability to regulate blood glucose, I mean, is changing for the positive by improving muscle function. And I think that's the greatest thing is, we all know that exercise, I mean, literally exercise is classified as the cure all for every disease out there. But if exercise is a stress, it can contribute to the problems, because exercise can actually create inflammation and add more stress and inflammation to the system, and actually can contribute to disease rather than prevent it. And I think that's one of the nice things is MAT. Now you say you get away from athletes, and all of a sudden you see the systemic change on somebody. And all of a sudden it's changing internal factors or mechanisms that we never even knew the treating muscles could actually impact. And that's probably been a craziest thing over the years. And I mean, but it does follow that whole principle that if muscles are functioning at a higher level and able to tolerate and produce force efficiently, then the body's healthy. So in reality, exercise is a cure-all for every disease out there, and MAT becomes the precursor to exercise to make the body capable of being able to tolerate forces.
Yes, exactly. And that to me is, there's such value in MAT because of that. Like if you just looked at that, okay, people can move better, their symptoms can change, everything like that. Like there's huge value in that. But if you just look at somebody's ability to just kind of do what they want to do in life and have fewer issues because of that, and be able to do the things that are actually supposed to help them be healthier and have fewer negative repercussions because of that, there's huge value to that.
Yeah, and it's great to see even the progression. Like you said, you came out of college, and I mean, perfect timing, able to move right into the MAT education process. And you went through the Jumpstart course, then you went right into the internship, into master level. And then in 2017, you have that shirt on, right? I see there, you got the RX shirt. You got certified at the RX level, which is the highest level of education that we offer with MAT. And can you explain kind of the progression for you and going through each layer and how it impacted, and how did one cancel out your education? Like you did the RX level, does that mean you discredit everything else you did, or how it just progressed, and how you've been able to take all levels of education and transfer it into your practice?
Yeah, you're absolutely right. So one level certainly does not cancel out the rest. In fact, it adds a whole, I don't want to say a whole new skill set, but it levels up your current skill set. And so the tools that you had previously, you're able to use those better. Okay. When I went from Jumpstart into the specialist program, I learned from just doing the picks in Jumpstart to then doing the DFMATs in the specialist program. Well, now all of a sudden, being able to use the picks also became more valuable because I understood, all right, the role of different individual muscles. And then going from the specialist program into the master's level, which now is essentially moving from, active setup and tests to passive, that just levels up your skill set. And so everything then that you're doing, even if you're not using a passive skill set with the client, even if you determine it's more appropriate to do an active skill set for a client, now your skills are better with that active skill set because you've been practicing feeling things out passively. And then getting to RX and just the accountability that comes throughout the entire RX process of really needing to know, okay, like, am I doing this test correctly? Or in what mistakes, what issues am I making? There's some accountability in the earlier programs, but RX, it takes it to a completely different level as far as like needing to know I'm doing these tests, as correctly as I can. And so then all of a sudden you have just a completely transformed skill set that regardless if you decide to do picks with people at the Jumpstart level, or if you're using, active at the specialist level, or you're doing passive with the master's level, or you decide to do RX, you have a level up skill set. And so it didn't cancel out anything. If anything, what it did was it made everything else more valuable.
Right. Yeah, that's great. And would you ever have imagined when you started the education program, going through the Jumpstart program, did you know what you were getting into and going through all this?
Wow, yeah, right. So I tell you this, when I started the program, I was really excited about the potential, but I had no idea that it would completely transform what I imagined for myself, for my career, for my future business. My business was going to be, a standalone, like training facility, turf, loud music, the stuff that you normally think of from an athletic training perspective. And this completely opened up a whole new world for me, not just from a professional standpoint, but also like personally what I became more interested in. It was no longer about bigger, stronger, faster. It was like, how do I get somebody's body functioning better? And that brought so much more satisfaction from just a personal standpoint, but like an intellectual curiosity standpoint. So yeah, it completely changed everything for me.
Yeah, it's interesting. As you know, I've been in pro sports for 30 years now, and there's so much more reward of working with somebody and improving their quality of life so that they can, literally tolerate everyday activity and not be in chronic pain or dysfunction, compared to getting somebody back on the field so they can make another $1 million or whatever.
Right.
It's like, it's so satisfactory to be able to improve people's quality of life. And I think, being an instructor, you say you've seen a lot of students come through the program, and I think the common denominator is the people that come to the MAT program. They're all trying to help people. That's their primary goal, is they want to be able to help people. And I think MAT brings those tools to the students to be able to do more optimal job in being able to help people's quality of life. Yeah. And if you had to say, looking at it as an instructor, what would you say as students that maybe potential students that maybe watching this and say, here's what MAT can do for you, and here's why I recommend that you should go down this path? What would be your statement for that?
So I think if you looked at any program out there, as far as all the different options that you could pursue professionally, you are not going to find a system that matches MAT for the level of quality, the level of results that you can get, the level of care and attention to detail that you can bring to every single client. So look, if you're just wanting to kind of shotgun something out to the masses and be like, like super hands off or whatever, then maybe this isn't for you. But if you really care about like helping the person that you are working with and really trying to take their function to a different level than they've experienced likely ever in their life, then this educational process is going to give you the systems and the tools to be able to do that. And really, I think that's a question that students need to ask themselves, is like, what am I looking for? Am I looking for something that I can really help people with, dive in deep, like go really deep? We're talking about like all the different education levels. You get to that RX level, you're going really deep with this, okay? So do you want that? Or do you just want another thing that you can throw some letters after your name and be like, oh yeah, no, I do this as well? Which are you? Because if you are the former, this program is for you. And you're not going to find anything else out there that's going to even come close to replicating this.
Yeah, and that's great. And the nice thing about it too is some people, I would say, want to look at it as being competitive to different fields like physical therapy or chiropractic, massage, whatever that may be. And the nice thing about it is it's a tool that allows you to improve, get better results with what you do, whether you're a physical therapist, trainer, chiropractor, whatever that may be. And there's one thing about MAT is we focus on muscle contraction, the muscle's ability to tolerate forces. And when muscles can tolerate forces at a higher level, there's less chance of injury or pain. And so the great thing is the process does function as an adjunct to every other field. It's not competition. It's saying, how can I make my skills better? Because as you know, one of my favorite phrases is, how do we know? How do we know when we put a force on somebody's body, whether or not it has a positive or negative effect, whether it's a chiropractic adjustment, whether it's a stretch, whether it's an exercise, whether it's an MAT palpation, whatever that may be. When you put force on somebody's body, how do you know whether or not it had a positive or a negative effect? If it has a negative effect and you don't know that, it may push them down the downward spiral further. But if it has a negative effect and you say, oh, wow, I just did that stretch on on them, or I just did a mobilization and that just shut down the muscles that support that joint. I better get those activated and kind of fix what I break. And so it's a great tool to tie in into any field so you can get optimal results with whatever skills it's not working against what you do. It's saying, how can I enhance the skills that I already have?
You know, that's such a great point. And so often when, you know, a prospective client calls in, they'll be like, well, you know, I've done this and this and this, and like, I just haven't seen the results. And I say, you know what? A lot of times that's actually a really good sign, because what we do with MAT is completely different than what you've experienced in the past. So even if somebody's coming in with a background of whatever profession they've been doing, this is going to give them a different skill set that, like you're saying, they can add to their tool belt, and they can use, you know, with the patients or the clients or whomever that they're working with, and it brings something completely different to the table.
Yeah, and it's funny, I've said it in classes, and I always say you don't even have to be good at MAT to have success with MAT. And part of that reason, and that's early on when we're talking the levels of education, obviously, like you said, the RX level, the level of skill to implement that process is, I mean, there's a lot more responsibility on the practitioner when we get the highest level of skill set. But early on, you start out and you're working with athletes, and you start implementing the principles. Like you just said, it's because nobody's ever looked at it this way. Nobody's looked at the body this way. So, you know, when you have somebody walking in the door, that they may have tried everything else. And here, I know that I have a unique process that nobody's looked at the body this way, where we're looking at the weakness as opposed to the tightness, and looking at providing stability to the body, to the point that, and from an MAT standpoint, we're not chasing pain.
Right.
We're looking at the idea that the pain may be in their hip, but it could be coming from somewhere above or below. And we just follow the principles of where you see limitations in range of motion will dictate where the problems are. The pain is just an indicator that there's a problem somewhere, but not necessarily where the pain is. So if they've gone to multiple modalities, or implemented different types of modalities on their pain issues, then it may be because they were focusing on the pain, and we're coming from it to say, why is there increased stress on those joints and tissues that may be causing this pain? And it could be coming far away from where the pain is. And so the process, one, because it's different, even if you're not, even early on when people are starting with MAT, they're just learning it and getting comfortable with it and already having success, because they're looking at people differently than what other practitioners have looked at them, or how other practitioners looked at them. So it's neat that way, in that it fits in its own realm. It's its own entity, but it works. We're able to work it with any other field and be an adjunct to the fields rather than any type of competition.
Yeah, absolutely. And just to build on that last point, like, that's one of my favorite aspects of MAT is when somebody comes in, if they're saying my symptoms in my shoulder, we have a way with the MAT skill set to objectively assess their system independent of their symptoms. And so you can say, like, objectively, okay, I know your shoulder's bugging you, but your trunk doesn't really move that well. Like, there's a limitation in your trunk. And you follow the system, you follow where their body is telling you, not their symptoms. And guess what? The areas that are symptomatic, more times than not, we see some really cool changes there. And it's because of that system that you put in place, Greg, that it's like, this is biomechanically based. This is not symptom based. That allows us to kind of step back and just objectively assess things.
Yeah, and that's the key. I mean, pain is the indicator something's wrong, but it can be far from where the problem is. Just like when your check engine light comes on in your car, it's not something wrong on the dashboard. It's like you take it to a mechanic and have them look under the hood to identify what's wrong. Well, when there's pain, it's really that's why we say with muscle activation technique, we're the muscle mechanics. We're gonna, if somebody comes in with physical complaints, we're gonna look at the body, lift up the hood, and look at the body movement by movement, muscle by muscle, and say, where can't they move? Because one of the phrases I've said, I don't care what you can do, I want to know what you can't do, because what you can't do is breaking you down. And the interesting thing is which people end up doing is like they call it voodoo or something else, because it's like, well, he treated my hip and my shoulder pain went away or something like that. But like you said, this is a sound biomechanically based process. That we're not chasing pain. We're looking at neuromuscular dysfunction, treating the neuromuscular dysfunction, which in turn can reduce pain or injury. And that's, I mean, there's so many examples that we've all experienced where, I mean, there's times by following the principles, there's times I've shaken my head and say, I have no idea why people had a positive effect there, except understanding the foundational biomechanical principles.
Exactly.
Yeah. And so one of the things, like you talked to all levels of education, and you are an instructor for us, and you started with the Jumpstart level, and you taught the Jumpstart courses, and now we have a book, the introduction to the Jumpstart and intro to MAT Jumpstart book, and your thoughts now for people that are trying to just say, I want to know a little bit more about MAT. I mean, one of the reasons I wrote the book, which the pandemic helped give the time, and
right.
we'll talk about yours here in a second, but the pandemic helped give the time to write the book and take something that was a course that people had to attend to now say, from an introductory standpoint, now here's a book that you can purchase that can actually start educating you on the principles and give you some tools to work with as a practitioner in any field. To start playing around with the principles. Like you said, you don't have to be good at MAT to have success with MAT. And if you start playing around with these principles through what you can learn in the Jumpstart book, our goal is to get people, to help people get a better understanding of MAT at its most foundational level. Being an instructor, what are your feelings on that information being transferred into a book?
Yeah, that book is such a value add for the community, for prospective students, for people who just want to learn more about MAT. I mean, we've had clients come through and say, oh, I need to get that book, just because they want to learn more about MAT and just kind of start seeing the process unveiled. And so if somebody is, interested in, just kind of getting to know I'm going to call it the basics, but really the foundational principles of MAT, I mean, you lay it all out, Greg. It's just such a well done manual of, all right, this is the thought process of MAT. This is how you start applying it. And clearly you can go deeper into the educational program. But if somebody just had this, like if that was the only thing that you ever put out in the world, people would be changing other people's lives because of how powerful that information is. And that's not an exaggeration at all. And I know that because of the results that I was getting simply by just going through the Jumpstart program. And so just taking the Jumpstart skill set and being able to apply it, it's such a powerful tool.
That's great to hear. And sometimes I even want to minimize the different levels of education, because it's progressed so much all the way to the RX level. And I go right back to those foundational principles of Jumpstart and looking at wherever it's now about positional weaknesses. Wherever you see a limitation, if you can't turn to the right, then it means the muscles that move you to the right aren't contracting efficiently to move you through that full range of motion. So the opposite muscles tighten up. And here's through isometric contractions, here's ways that you can actually train people's bodies how to move more effectively into the positions they can't move into. And as you improve those muscle contractions, then the tightness is the first sign of neuromuscular dysfunction, and pain is the second, where it shouts out and saying, quit putting force on these tissues until you fix the problem. And these basic principles of MAT, I think, can just help people at the most foundational level start, implementing it with their clients. If you're trainers, if you're therapists, to give them home isometrics to do. I think there's many ways that people can be able to transfer the Jumpstart principles in their daily routine. And in the big picture, then they say, wow, if this is the most basic level, now we have a whole education program that lays every level of education that can raise the skill level for any practitioner.
Absolutely.
And so that if anyone's interested in the Jumpstart book, you can go to muscleactivation.com and there's information regarding the book. And speaking of books, and I know through the pandemic, I mean, you've been, like you said, specializing in the exercise side of it. And I know you wrote a book. So
Yes.
tell me a little bit about your book.
Yeah, absolutely. So my book, like you said, Greg, is focused on exercise and specifically how exercise actually helps people get healthier. You know, we hear that, okay, we need to exercise for our health, but we don't really get told like all right, you exercise and then you get healthier. It's like, okay, well, what does that actually mean? How does that happen? Is it just like, you know, my heart health improves or what happens? So what I wanted to do was look at like, how does exercise actually help improve the health of our muscles, the health of our joints, the health of our cardiovascular system, the health of our brain, help us to like ward off chronic disease and illness, help us, you know, to improve longevity. And so all these different aspects. And so that's what the book is about, is really looking at, okay, look, if you want to exercise, but you don't like the current version that mainstream fitness is putting out there, as far as like it has to be more sports performance in nature, or it has to be like really high intensity or anything like that, like if that's just not vibing for you and you're not interested in trying to lose a whole bunch of weight or anything like that, you just want to be healthier, well, then this book kind of provides a roadmap of how you can go about doing that and how exercise actually helps to do those different things. And so it was a really fun project to work on because it forced me to think about exercise in different ways, and allowed me the opportunity to kind of explore different ways in which exercise, like I said, you know, actually improves cardiovascular health, improves brain health, you know, promotes longevity, all the things that we hear that exercise should be doing, but then kind of diving in deep and saying, well, if you actually want these results, here's what needs to happen for with your exercise, and here's why.
Mhm. Well, and it's great because you could kind of follow up with the definition of insanity, where you do the same thing over and over and over, and you get the same result, and it's not the result that you're looking for.
Yeah.
And literally, and I think, I mean, in the exercise world, we know that. And I spoke for years in the health and fitness industry, and how many people have clients that have pain, everyone would raise their hand. How many people here have pain? Everyone would raise their hand. And it's like, well, something's wrong with the industry. And it is because, and like you just said, and congratulations on writing the book. I mean, I know it's a big undertaking to do something like that. And but it's that idea is you can, I mean, kind of beat your head against the wall, and people are exercising, and you see them 5 years, 10 years later, they don't look any healthier or feel any healthier than they did before. So to have something laid out, and I know, and just through reading your book, and I mean, and one of the factors in there is you got to prepare your body to be able to tolerate exercise.
Yes, exactly.
And that's, I mean, it's a great adjunct to be able to take. I mean, I'm 100% MAT, and with that's what I do for a living, teach for a living, and it's my life at all levels. And to be able to take the principles and then take it into what you're in an exercise facility, and you're trying to work on people's health. And I know MAT is a big part of every person that exercises, and I think that's an important factor. I know that's all over your book and all through your book is how important that is, and I think that's a big factor for people to understand is that. I mean, if you're going to exercise, I would say life's going to beat us up. And from a neuromuscular standpoint, somebody has to be there to put you back together so you can get the optimal results. And exercises, like we said, can break you down. And when we're young and athletic, we can recover and repair and get bigger, stronger, faster, whatever that may be. But as we start having injuries and inflammation, and we sit at a desk and we're less active, whatever that may be, it's not as straightforward. And now exercise becomes more of a stress, and we don't recover from it. And if we don't recover from it, every goal that you just talked about that people may be trying to achieve from exercise, you can't achieve. And so it's nice to have something laid out, and that you laid something out in a format to say, here's a way to reach the goals that you're trying to achieve from exercise. Because I think there are a lot of people that are banging their heads against the wall and following that definition of insanity, saying, why am I not getting the results I want from my exercise programs?
Yeah, no, thank you. I really appreciate that. And yeah, you're right on. It's like if somebody's body can't tolerate how they're exercising, well, then exercising isn't a viable option for them, or at least not in that manner. And so having a tool like MAT to help prepare people's bodies for exercise and then make sure that they can keep exercising while they're going along and continuing to progress, there's such just a beautiful harmony between the two of helping people, yeah, live healthier, function better, and really do the things that they want in life with fewer issues.
Yeah, and I think you would agree. I mean, I say it and I believe it, and we've had a few thousand people come through the program over the years. But I believe just like any other modality that is in every city, every state, every country, I believe that as we grow and continue to bring this education out there, I mean, you're an instructor for our courses, and we really appreciate everything you do. And I believe it's just going to continue to grow for exactly the reasons that you discussed. It's for everybody. And
Yes.
so it needs to be in every corner, in every city, in every state, in every country. And that's our goal with MAT. And thank you for being a part of that growth.
Oh, it's my pleasure. I really appreciate all the opportunities and the community as a whole, and you, Greg, all the work that you've put in and making it just so possible and feasible for all of us to help people in this manner.
Well, thank you very much. And thanks for everything you do. Appreciate everything.
You bet.
Thanks.